As modern medicine and technological advances rapidly expand by day, it is becoming more important to meet the demands of the growing radiology field to provide faster, more accurate, and easier experiences for patients and specialists.
As such, we have resorted to have a heavier reliance on robots and artificial intelligence to work alongside doctor and specialists on international scale. Currently, there is a lot of speculation on AI and its impact on the future of healthcare, particularly in radiology.
There are many that speculate that AI will completely change and subsequently take over radiography. That leaves us with the imposing question, will the future radiologist be a robot? In this presentation, we aim to explore both sides of this question by getting expert advice and interviewing professionals on both sides of the argument. So, Professor Wang, do you think the future of medical imaging will be dominated by robots or AI? And what is your opinion on the subject?
There is no way AI can replace radiologists, at least not in the current healthcare system. People who don't understand medicine think AI will replace radiologists are naive. They believe what we do is to recognize pictures. That is square one, and current technology does an abysmal job of that. The few publications saying their technology does as well or better than radiologists are full of technical problems that invalidate their own claims. My fear is the lack of knowledge and utilization of such technology. Paired with that is the concern that those in the position to purchase these things don't really care about its function, only that it would cost much less and therefore improve profits substantially. All of us in medicine have seen at one time or another administrators happily compromising care to make more money.
What are some challenges of realistically applying AI as a central mode of operation within diagnostic and interventional fields?
The outrageous statements given by some artificial intelligence developers about replacing radiologists are far-fetched, as these software may be better in their controlled test conditions, but none of them is equipped enough to detect all the findings and then integrate everything into a cohesive diagnosis. Perhaps they should realize that nothing performs as well in the real world as in the testing conditions. An important issue which needs to be addressed is if the artificial intelligence robots take over, who will do the patient-facing tasks? These can be as simple as personalizing treatments, performing scans, and consulting patients. What about responsibility? Are their softwares good enough to not miss anything? And if at all there is a miss, who is responsible? The next important issue is trust. When a machine sends out a report, will the patients just trust and get their medical and surgical interventions done based on the results? It is almost unfathomable to imagine the owner of an AI system opting to take full legal responsibility of a machine output when human lives are on the line. Not one single existing AI system that has medical regulatory approval has yet claimed to be a decision maker, and I sincerely doubt that one ever will. This is because it is impossible for an AI system to ever be 100% accurate in solving a medical diagnostic question. There will always be an outlier, and for that reason alone, we will always need some form of human oversight. Anything that deals with human lives simply can't be trusted on with machines or algorithms alone.
Do you think the future of radiology will be dominated by AI or robots? What's your opinion on that subject?
I think the future of radiology will be robots, and we will need to use AI as the main device in medical imaging, not humans. As radiologists, we need to go through more and more images every day, and it becomes inevitable that part of our job will need to be automated. Firstly, training a radiologist is a long and tedious process and costly as well, and it takes almost about 15 years of post-secondary education and college, and costs hundreds of thousands of public and private dollars. The average radiologist graduates with more than $200,000 in debt before ever embarking on actual specialist training. According to experts, the benefits of AI in radiology are numerous. It can reduce workload by doing tedious tasks like segmenting structures. It can also help to detect lesions that may be subtle, which can be useful when the radiologist is tired or distracted. Finally, it can find information in images that is not perceived by humans, like in molecular markers in tumors.
How efficient are AI systems and what exactly can they do within the diagnostic radiology field? What are some current advances so far?
Good question, Kevin. A team at Oxford University developed a system for detecting spinal disease from MRI data with a performance equivalent to a human radiologist. Meanwhile, in the University of California, CT scans with an error rate of more than 20 times lower than a human radiologist. Future applications of deep learning can extend beyond imaging data to include health records, pathology, cellular microscopy data, and even more to help develop targeted drugs and achieve precision in medicine.
So, why does interventional radiology need robotics?
Learning to manipulate a robot to do complex interventional procedures means that the radiologist can be outside of the actual procedure itself, and therefore they will not actually receive any radiation exposure. Also, the robotic instruments have better navigation than humans. This means that in patients with complex anatomy, navigation of the interventional devices would be easier and therefore safer for the patients as well. Furthermore, the newest robotic instruments are magnetic enabled, making MRI guided interventions faster and even more accurate. In conclusion, I believe that AI is poised to significantly increase the value of radiology professionals and as well as patients. Adding information acquired from AI algorithms to our reporting and workflow can significantly improve patient care in radiology.
The use of robotic assistance allows greater operator precision and control. This improved accuracy can lead to reduced procedure time, radiation exposure, recovery time, procedure complications, and mortality. An additional advantage is remote operating use.
However, AI systems cannot store all the medical diagnostic report. Currently, we haven't perfected on the algorithms for computer to detect the disease as well as storage data space and the concern of trust issue and legal responsibilities. After weighing both sides, we believe that AIs will not take over the radiologists. Rather, they will work alongside a human to improve the quality of treatment and diagnostics.